Medical devices, infusion pump, Lesson 2, structure of infusion pump and infusion free flow. This unit covers the basics of medical devices. The goal for this lesson is to learn about the structures and functions of infusion pumps, and to understand free flow of infusion pumps. This is the content of this lesson. The internal structure of the infusion pump is as shown in the picture. Although there are differences in the structure depending on the model, the basic functions are the same. Each of these basic functions will be explained in this lesson. The air bubble sensor monitors air bubbles in the route to prevent them from being sent to the patient. The occlusion pressure sensor monitors the occlusion status on the patient side downstream from the infusion pump and detects if the clamp is remained closed or the tube is bent. The tubing guide is responsible for guiding the proper installation of the infusion set. The peristaltic finger is the main part of the infusion pump responsible for peristaltic movement to perform the infusion. The tube clamp is a mechanism to prevent free flow infusions. The clamping mechanism works by automatically clamping the infusion tube whenever the door is open. Free flow infusion needs to be paid attention to the most when using an infusion pump. Free flow occurs when the pump door is opened without closing the clamp of the infusion set when changing the infusion or turning off the alarm. The free flow causes a large amount of infusion due to a height difference. As a preventive measure, always remember to close the clamp when opening the door of the infusion pump. In case of emergency due to human error and so on, a tube clamp mechanism is provided to automatically clamp the inner tube when the door is opened. The tube clamp prevents the accidental infusion of a large amount of medication or fluids. This is the end of Lesson 2, Structure of Infusion Pump and Infusion Free Flow. Make sure you've mastered the basic concepts before you move on to the next level.